Hello, my name is Dr. Ganan, and I'm a physician here at Virginia Integrative Health. And one of the things that I would like to focus on today is talking about neuropathies. Now, neuropathies are issues with your peripheral nerves where you have a loss of sensation or even pain for various reasons. One of the most common causes is diabetes or chronic elevated blood sugar. Another very common cause is chemotherapy, treatment for cancer. And then unfortunately there's many unknown causes for neuropathies. Even with very intense investigation, sometimes we can't find a cause, and that can be very troubling for patients. But one of the ways that we are different here at Virginia Integrative Health compared to many neurologists is that we at least try to look for different causes. We don't just try to give you a medication such as Lyrica or gabapentin. There's many medications out there, but we try to search for what is the reason that you have this neuropathy, and is that reason something that we can interrupt, that we can correct through changes in your diet or your own biochemistry. Now, even though this is something that I do all the time, since I'm sitting here on camera, I realize that I may forget things, so I have a little cheat sheet here to refer to. At Virginia Integrative Health, in general, we look for about 20 different causes or contributing factors to neuropathies through various tests, both blood and urine tests. We were taking a deep, comprehensive look at your biochemistry and your physiology. We're also looking at your biomechanics. We try to take a team approach to all of our patients who come in addition to myself as an MD, looking at our patients from a biochemical standpoint. We also like to have all of our patients visit with our chiropractor so he can look at people from a biomechanical standpoint, because at times nerve pain can be created from imbalances in the musculoskeletal system. And then we are also looking very strongly at diet and the dietary components, and having our patients work with a counselor to make changes in diet to decrease people's inflammation, because we know that a significant contributing factor to neuropathy is inflammation. So in addition to the biomechanical things that our chiropractor will be looking at, biochemically, we are looking for vitamin deficiencies. We've had patients who have come in and simply by finding that they've got a deficiency in vitamin D and some of their B vitamins, just by replacing those, the patient had an improvement in the neuropathy symptoms by about 50%. So sometimes it's as simple as finding nutritional deficiencies. We look at your immune system. Is your body attacking your nerves? Unfortunately, there are many different processes that can set up what we call an autoimmune response, where for whatever reason, usually through an inflammatory trigger, your body is upregulating your immune system and creating antibodies to itself. And one of the tissues that can suffer is your nerve tissue. And as a result, people will start feeling numbness in their fingers and their hands and their feet and toes, as that nerve tissue is destroyed from the outside in from that autoimmune response. And luckily, there are things that we can do to quiet that autoimmune response to prevent the neuropathy from progressing. And at times, then there are also things that we can do to heal some of that damage. Changes in blood sugar, high blood sugar, chronically high blood sugar, or at times even chronically low blood sugar. Some people are very sensitive to that, and high blood sugar especially is inflammatory. And when there is too much sugar floating around in the blood, that inflammation can attack the nerves, and that can be a cause for neuropathy. Candida. Candida is a fungus that we all live with, we all have in our colon, but unfortunately through poor diet, lack of exercise, exposure to antibiotics or other medications, people can have an overgrowth of this fungus in their intestines. That can lead to something called leaky gut syndrome. And leaky gut syndrome can be a precursor to that autoimmune response that I spoke about earlier. So we look at gut health to see what can we improve in the gut. Are there things such as candida, which if we can treat that, if we can decrease those levels of candida significantly, we know that we will improve the health of the gut milieu, which will lead to an improvement in overall health by decreasing inflammation. So the overall idea is, we just want to look at the whole person. We want to look at everything that's going on. We don't want to just say, well, you've got this neuropathy, so take your medication to treat these symptoms, and as it gets worse, we'll try to increase your medication, and if that doesn't work, you just kind of have to live with it. Neuropathy certainly is a tough thing to treat. It's not always easy, or it's not even always possible to find the root cause, but we think that it's important to at least try to look for the root cause, try to make modifications in people's life, in their diet, in the things that they are doing day to day to decrease their inflammation as much as possible, to modify their internal biochemistry so that they have the least likely setup to keep attacking those nerves. So we try to correct as much in the biochemistry as we can. Then we try to correct the biomechanics through visits with our chiropractor to make sure your alignment is as good as it possibly can be. And then on top of that, there are neuropathy injections that we can do with a substance called Serapin and lidocaine to block nerves and potentially help them heal over time through an anti-inflammatory effect. There are trigger point injections that we can do by treating tight points throughout the back, throughout the neck, that can lead to a relief in pain by helping the biomechanics. So those are a few examples of all of the different things that we can do from the inside out to try to give people a fighting chance to see improvements in a condition that honestly has a significant impact on people in their daily life. It's very disheartening for people to have so much of a loss of sensation that they feel like they can't feel their feet. They feel like they're going to stumble or fall going upstairs, or they feel like they can't even drive their car because they can't feel the accelerator pedal. Or sometimes people have pain that is so crippling it's constantly waking them up at night. And when you have things like this, the effect on quality of life is significant. So we believe here at VIH that we need to do everything that we can to try to give our patients a fighting chance. So give us a call. I think that we at least will do everything that we can to try to get you the best possible result for your neuropathy.